Deepak Patel. I'm a family physician and sports medicine physician with Rush Copley Medical Group. I chose to be a family physician because I enjoyed multiple different specialties in medicine, and being a family physician allowed me to explore all of those interests and not narrow too much of my focus. I also like being a family physician because I develop a greater relationship with multiple members in a family without restricting who I'm able to see and care for. So my personal approach to patient care is more of an interaction and discussion with a patient. I feel like my responsibility is to bring my expertise, my experience and knowledge to the patient visit, and then help them make a more informed decision about how they'd like to proceed with care. So my interest in sports medicine began when I was playing sports when I was younger in school. I played several sports, but I became injured quite often, and so I felt like I needed to look for better ways to heal and to get back to playing. The services I provide as a sports medicine physician vary significantly. I do anything from fracture care to minor sprains and strains to treating osteoarthritis in various joints, concussion care, and anything related to an athlete. The sports medicine part of my practice is not restricted to just purely competitive athletes. It can be someone who has a fairly laborious job or work that requires a lot of physical activity, and they have an injury of some sort, and they need to get back to better function. It's also for anyone who may have had any type of musculoskeletal injury, such as an ankle sprain, a broken finger, etc. We evaluate all levels of head injuries for concussions at all ages as well. In terms of treating the concussions, it varies significantly determining on the severity of the injury and also the demands of the student, the athlete, the adult, whoever it may be, and what they will be needing to do and what they're having trouble doing right now. Evaluating and treating our concussions, we're able to utilize the latest technology and the latest science to bring those together in testing and evaluating the severity and progression of concussions in our care. When we have children with concussions, we're much more conservative in terms of ensuring that it's safer for them to return than adults. Their brains are still developing, so we're much more careful as to being confident that they are ready to return before we try that. And I love what I do. Even my hobby is to stay up with the latest literature and the science behind medicine and what we do. I've been fortunate enough to be invited to speak and teach and lecture to other physicians about especially sports medicine topics. Doing this has been valuable for several reasons. It keeps me on the cutting edge of the latest and most effective treatments for patients. It allows me to interact with other physicians, and it allows me to continue to hone my skills to become a better physician as well. I grew up in a small town, and that's the beauty of our current practice, is that I understand folks who live in smaller communities and how important the physician can be and how close-knit the entire community is and how much of a pleasure it is to work in such a community.